This exercise DVD has been developed to support graduates of the pain management programmes run at North Bristol NHS Trust. It's designed for people who have already learnt the exercises on a pain management programme and are aiming to maintain or restart their exercise programme. The exercise DVD shows a range of options for each exercise, and we hope that the version that you learnt on the programme will be covered by the DVD. Occasionally, individuals are taught a slightly different exercise on the programme, and very occasionally they may have been advised not to perform a certain exercise. If you don't recognise the exercise as it's shown on the DVD, then you might need the support of one of the pain management programme physiotherapists to restart this part of the programme. If this is the case for you, then start the exercises that are familiar to you and contact the centre for advice. We hope that most people will recognise all of the exercises and will be reminded of how they started out with the exercise and how they made progress with it during the programme. We know from past experience that people stop the exercises for a range of different reasons. Sometimes it can be because of illness or other health reasons, and it can be because of a particularly busy time in life when it feels as if there's no time to exercise. If you have had a break from your exercise programme, you'll need to start at a lower level again. Hopefully you'll remember from the pain management programme how to set a baseline for exercise. You may even have your exercise sheets from the programme, which will show you how many exercises you started with initially. If you can't remember, it's best to find your handout on setting a baseline to remind you how to do this. Your baseline is your starting point, in other words, the amount of each exercise that you can do every day. If you set your baseline too high, then you won't be able to keep up at the same rate every day. The next section of this DVD contains some handy hints to help you restart smoothly. Firstly, it's worth making a point of deliberately underdoing your exercises for the first few days, so that you can make a gentle start and can increase the number of repetitions later on. Longer term progress is the main focus here, rather than rushing things too fast and having to start again. Secondly, remember that most of the exercises can be made easier, either by reducing the number of repetitions that are done, by making a smaller movement, or by moving more gently. Remember, there's nothing wrong with starting with only one repetition of an exercise. Once you have set a low baseline, it's probably best to stay at this level for a few days before pacing up. When you do pace up, you could choose to make a larger movement, to increase the number of repetitions, or to increase the speed of the movement if you're working on the strengthening exercises. The stretching exercises work better if you stick to a slow, relaxed movement, and most people find that they end up doing smaller numbers of the stretching exercises and focus on building up the numbers of the strength and stamina type exercises in the long term. Another way to pace up your exercises is to add a second exercise session in the day. Once this second session is well established, you might decide to add a third session. This is a form of pacing in its own right, because you'll be breaking up the exercises into small, manageable chunks throughout the day. One last thing to think about before you start your exercise programme is whether you'll start with all of the exercises or just some of them. One way to tackle this is to rate each exercise according to how difficult it might be for you as an individual. An easy way to do this is divide the exercises into 3 types: easy, moderate and difficult. You might draw up a list and start at first with the easier exercises. Once you've made progress, you can move on to the moderate exercises. And once you're rebuilding your fitness and confidence again, you can step up to the more difficult exercises. You should find that your progress in terms of fitness matches your progress in terms of confidence with the exercises. Do keep a record of your exercise programme so that you can learn about the best rate of increase for you, and you have a record to look back at if you need it in the future.